Communication is so important, and today leaders fail to understand that when they're thinking about driving innovation, it cannot be just restricted to the boardrooms. They need to expand that. They need to have that communication, and it's not a single or a one-way communication. It needs that feedback.
So whenever you sit with decision makers, you want to discuss innovation. Each one of them is talking about innovation from a different perspective, but nobody actually is talking one language.
Thank you, Maryam, for doing this. It's probably, I would say, manifestation, destination,
Yeah.
or destiny, I would use that word, where we sat on a lunch table today and started talking, and one led to another, and you and I connected and said, okay, why don't we just do this, right?
Yeah.
And you're a person of many things or many world, and you want to do something like this in your future, and hopefully
Very near future.
very near future, inshallah.
Inshallah.
And hopefully you start it soon. But you want to share a little bit about you? What do you do? What your background is?
Yeah, so my actual background is dentistry.
Okay.
And the thing that I love about dentistry is the giving part, where you actually help people relieve their pain. But that wasn't really my ultimate passion. I felt like I'm more like a people's person. So I used to find myself more engaged in projects that are to do with helping others, like philanthropic projects, being part of community service projects. And every time I went to one of these projects, I was one of those people that kind of suggested improvement of a performance, whether it was a project, whether it was a trip. So I was like, this is what I really like. This is what ignites me.
Mm-hmm.
So I ended up doing quality master's degree, quality management in healthcare, my master's degree. And it didn't really detach me from the healthcare sector, because then I went back to the healthcare sector, but with a different role, like a clinical one time, but full-time or more like into performance improvement, quality management, assessing how to improve the healthcare sector. And I was very lucky to say, or probably distant, to be nominated as one of the people that kind of built the Directorate General of Quality Management. We were a task force of 4.
Wow.
Led by an amazing visionary leader that I find him my teacher, as well as an amazing leader that kind of shaped my character. And he gave us a lot of ownership despite our young age, and being at a young age, creating a whole directorate for quality improvement for the national healthcare of Oman was something that I'm really proud to be part of. And once we established the different departments and sectors, we've created for the first time in Oman innovation section in the healthcare.
Okay.
That should lead innovation healthcare moving forward. That was in 2014.
Wow.
That's way before the vision of 2040, which is talking of Oman, which is really emphasizing on innovation. That was the time we've actually created it. And he nominated me to handle that. He felt like I was always thinking outside the box. I'm always talking about performance. So that despite it being a section, he was like, you're the best fit for this. You're going to make it happen. Of course, moving forward, resistance, something new, too costly, The strategic plan for innovation was actually kind of declined. And now, a few years later, moving forward, I'm in a conference talking about innovation management that I've been wanting to talk about since 2019.
Wow. Now, talking about innovation, and this is where you and I kind of connected, you spoke about, how do leaders understand and get onto the topic of innovation? And do they believe in innovation? And sometimes how cost, or the cost of technology, cost of data, cost of everything what we want to do becomes a hindrance in the way of innovation. You want to share your perspective, and I have some thoughts on that as well.
Yeah. As I was saying in my presentation, pioneer innovation management to reach efficiency. What I was trying to raise in my presentation is that innovation is not necessarily what they call it, the dramatic change.
Mm-hmm.
Digital health And any tools within digital health could probably be very costly.
Yeah.
However, there are simple things that happen on daily basis by the task force of the healthcare, which is quite innovative, and it's creating a valuable impact in the dimensions of quality, in the dimensions of patient safety, in the reducing of cost, reducing of waste, that people don't know that this is part of the innovation criteria.
Okay.
And so whenever you sit with decision makers, you want to discuss innovation, each one of them is talking about innovation from a different perspective, but nobody actually is talking one language. They're either talking artificial intelligence, and that's it, digital health, and that's it, digital transformation, and that's it, when actually innovation is anything different that you do to something existing or creating something new that adds value by implementing it.
So apt, because in my mind, innovation is all, and all strategies are all good in paper.
Yeah.
If you don't take that first step, and let it be a wrong step.
As long as it's in healthcare, as long as it's not jeopardizing the patient's safety and health.
Perfect. And even if you don't take that first step, and today COVID and the last 2 years, I have spoken to a lot of doctors, people who are pulmonologists, right, focus on chest. And I said, how was your experience in the first year? They said, we didn't know how to treat people. And what happened then, and this good friend of mine, she said, the only way we started understanding different forms of treatment when we started connecting with people.
True.
Now, would somebody call that as innovation? My answer is yes, because what happened is it transformed, like the use of steroids, the use of the cylinders, the oxygen cylinders, right? Nobody thought about it because everybody was so scared. Nobody knew the treatment because it was a novel disease. When I say that, nobody knew what the stance was, and science was not able to catch up. That's where humans got involved.
Exactly.
And started experimenting, taking those first steps, and bringing innovation in the space.
Actually, I want to emphasize on two things you said. The importance of the human element as staff being innovative and creative way before science can prove it. And the patient experience and listening to your patient needs. Actually, both of these things, there are crucial areas of opportunities for improvement that are considered in the definition of innovation in healthcare, an innovative solution. And it comes under the area of communication. Because if you change the way you communicate and interact, that is changing a model that already exists from old to new. So just emphasizing on two things you raised, the human factor and innovation, and the communication with your with your clients, which in the case of healthcare is the patient. And in COVID, the interventions of human beings as task force in the healthcare has proven to be faster than science. And the reason it was because they were listening to the immediate need. They weren't following a protocol. There was no protocol at the time.
Yes, all protocols were broken.
Yeah, all the protocols were broken. You didn't have anything to follow, so you had to take a risk so that you could save lives.
Yeah.
Yes, we did mistakes, but that's a collateral damage. But if we didn't take the risk, we wouldn't have reached where we've reached now in terms of this giant leap in healthcare and the way it's shaping healthcare. So when you said that communication is innovation, actually, when you read through my presentation, communication as a model, the model of communication and changing from just focused on face-to-face to becoming virtual, to becoming through apps, to have, that model in itself is an innovation. To incorporate other ways of communication just to make it faster and easier access for all people to have same equality, we call it, of healthcare access, that is innovation. Even if it's a phone call.
Yeah.
A phone is existing since God knows when.
Yeah.
But if you use it to treat a patient at the time of
The need.
crisis, at the need, that is an innovative approach of communication.
Yeah. No, communication is so important, and today leaders fail to understand that when they're thinking about driving innovation, it cannot be just restricted to the boardrooms. They need to expand that. They need to have that communication, and it's not single or a one-way communication. It needs that feedback. Like even in the healthcare, when doctors and caregivers were actually treating, they were actually communicating. They were waiting for the response, verbal or non-verbal. You know, if you are on a ventilator, you may have signs and the doctors are communicating like thumbs up, thumbs down,
Yeah.
okay. But those forms of communication help to get and understand whether those treatments were working. But, you know, I want to take a step a little different.
Yeah.
You know, people have wrong perceptions about Middle East as a market, and you represent Oman.
Yes.
And especially you driving your innovation at that age. Is it been easy for you?
No. No.
And sorry if I'm touching that topic.
No. But actually, this is a very important topic, and a lot of people need to understand that resistance for anything new is inevitable.
Yeah.
And the fact that I'm not very surprised is because when I was establishing quality and I don't want to say imposing, but when we were proposing new policies, new procedures, the idea of documenting, the idea of auditing, and I'm not there to police you, I'm there to help you improve, that was resisted for so many years. But because I've lived a transition from being in a resistant phase to now seeing compliance because they've seen the impact on them as a task force, as it protects you as a task force when everything is documented, and although it could cause the burden at some point. So whenever we do suggest a new change, even on the topic of quality, there seems to be a lot of resistance, especially with healthcare providers, because they're very tired, they're burnt out from the system. Adding more extra tasks that it's not medical is really disturbing to them. But once it becomes a habit, it just becomes part of your subconscious, and subconscious doesn't take a lot of time. So innovation being resisted, I don't want to say resistance, I want to say neglected. More like neglected or denied because they didn't see that it was coming that fast.
You know, I would love to continue this conversation forward. I know you're super busy, you're attending this conference, you have presentations, but it's been an absolute great to hear innovation. And the reason why I picked up this last topic, because people believe, especially in Middle East as a market, people are backwards, right?
Yeah.
But people have not seen Dubai, and people have not seen Oman, people have not seen like what Qatar did with the World Cup. You know, nobody has seen that part. And today, people like you coming out and sharing this perspective is so phenomenal. And this is actually very near and dear to me as a topic because I'm born here, right?
Yeah.
It's like I'm having, you know, a heavy heart when I say that people have a lot of wrong perceptions. But there's so much of innovation happening. There's so much to do.
Actually, Oman got an award for being one of the first countries to have an automated patient patient file like HIMSS.
Wow.
It actually got awards for that system, and it was one of the very first countries that incorporated different health institutes to have one patient file. And now we're just expanding and expanding. Nobody knows because, like you said, people think we're behind, but we're not. We're actually putting a lot of effort. Resistance is inevitable in any country, despite where you are. Any fear, any change creates fear, and any fear stops you from moving forward.
Yeah.
And I think to wrap up, I would like to say, yes, innovation has a lot of uncertainty in it, but it's like business.
Yeah.
The more risk you take in business, the more the chances that your profits are higher.
Yeah.
And innovation, it's an uncertain outcome.
Yeah.
But if it works, it takes you into a different leap. You really, really get into another shaping of the whole ecosystem.
Very interesting. Well, thank you, Dr. Maryam. I would call you that for your time, for your valuable time, and making time at this conference. Really appreciate it.
Thank you so much. This is really a delight. I am very happy and honored to be on your podcast, and I hope this reaches as many people as possible because we really need to improve our innovation management process. The more we improve it, the better we can incorporate innovation in our healthcare system, which we need it very much. And I really call for all CEOs and executives and decision makers to actually find the gems and the talents in their workforce because they're really, really amazing entrepreneurs that needs the support to be creative, to create more solutions. And I'm here to help in any sense and manner, because this is what we do as MT Consulting. We help you identify your entrepreneurs, make them have the space for creativity, more innovation, and then help them incorporate that into the system for more innovations and better future.
Thank you. Thank you for your time.
Thank you so much. Thank you. And good luck with your journey.
Thank you.